For older workers, one of the things that I think is a big topic that really hasn't been discussed extensively yet is what is the challenges of health care for older workers, especially those between 50 and 65, because that is before they're eligible for Medicare. And in many small businesses, there is not health care provided. I assume you do not provide health care at your business.
We do not provide health care. And Annie, 2 of her paychecks goes to pay for their health care, and Corliss, probably 2 of her paychecks each week goes to pay for their health care.
And I am aware that you mentioned in your written testimony that their pay was about $25,000 a year, $12 an hour.
Yes. And I'm a high payer for my area.
And you're a high payer for your area.
Yeah.
And I believe that your state is similar to my state in that they have not expanded Medicaid under the Affordable Care Act.
No, I don't believe
so
that.
your workers cannot qualify for subsidies. The irony is that they are too poor to qualify for subsidies.
Yes.
If they made a little bit more, their health insurance would go dramatically down.
Right.
Because they would be entitled to subsidies under the Act. But
Right.
because your state, like Missouri, has refused the federal dollars that were identified, that could make a big difference in terms of
And it would make a big difference.
for these older workers who are working hard.
Really
It's not as if they're sitting at home. They are not I think, the typical vision that people have of a Medicaid recipient. These are people who are working and providing great value to your company.
Yes, they are.
And what about pre-existing conditions? I noticed also in your testimony that 2 of your workers had had cancer.
2 of my workers have had cancer, and it's an issue for them.
So if we didn't have the ability to not discriminate against pre-existing conditions, that would be even more difficult for them in terms of their ability to get insurance.
It would be very difficult for them.
And Ms. Hannon or Dr. Ricks, I'm assuming that the ability to change jobs and retrain at an older age has been dictated up until very recently, many times by the fact that you didn't want to leave your job if you had health care, because if you'd have the nerve to be sick before, you couldn't go get insurance somewhere else because, in fact, you had a pre-existing condition. So I'm assuming that there's more portability now for older workers that want to follow a dream or want to start a business or want to do something differently.
Excuse me. I suspect that's the case. However, access to health care still involves money. You have to pay for it. It's not free.
Right.
So the continuing high costs of health care may be still preventing some people from pursuing that dream.
Right, because they have the benefit in a job and they would have to be paying for it themselves
Yes.
if they started their business or perhaps went to work somewhere that was a much smaller company that wasn't required to provide any benefit at all. I understand, Ms. Nordman. You are doing something that is very unusual in our country, and that is trying to revitalize manufacturing in rural communities. I grew up for part of my childhood in a town called Lebanon, Missouri, where we had a facility that was manufacturing jeans. And it's, of course, long gone. And many other facilities like that across Missouri and rural communities that provided important manufacturing opportunities. So I get the challenges, and I get that what you're doing, and the fact that you've got 10 and you're looking for 2 more, that shows that you're smart and you're doing the right thing and you're expanding your workers because obviously you've got demand and you're producing something that people want to buy.